starting your route to retirement.
As always, thanks for listening to the Guided Retirement Show. We know there's thousands of podcasts out there. We appreciate you choosing to listen to ours. This particular podcast, you know what? It doesn't matter if you are Medicare age eligible or not. You know someone who is Medicare age eligible, and Medicare supplements are a super confusing part of your retirement. And as we talk about on the Guided Retirement Show, we want to cover all topics that have to do with your retirement. And joining us today on the Guided Retirement Show is Tom Allen. He is a Medicare expert. He is a Medicare supplement expert. And Tom goes through certifications every single year to make sure that he stays on top of all the latest and the greatest. And he brings it to us in a way that it's down to second grade language so that we can understand it. He doesn't talk over our heads. You're going to get some clarity here on the Guided Retirement Show on the ins and outs of Medicare, what it does, what it doesn't do, what it's designed to do, and what kind of supplements you may want to have on top of your Medicare. Enjoy the Guided Retirement Show. Well, Tom Allen, a retired health insurance professional, 38 years, you get into retirement and you decide, I need to help people with Medicare supplements. So in 2002, you get your CMS certification. What is that?
Centers for Medicare and Medicaid, the godfather of Medicare, if you will. They require people that are selling or doing this type of coverage, they want them to be certified. They're really trying to weed out the people that should be doing something else and try to pick the people that are doing this for the right reason. And the people that, their definition of that is that you have to go through an education process annually. And then at the end of that, you're quizzed. And you have 3 opportunities to pass an exam that requires a 90% passing rate. And if you don't pass it during those 3 attempts, then you get to wait 12 months before you can try it again. So they're real sincere about trying to have people educated to the point where they can do the job of telling people what's available and educating them on what their choices, and
that's an annual certification.
Annual
so
certification.
You got to do this every single year.
That's part of August for me.
Okay.
which is a part that I don't enjoy, but it's at the same time, this is terribly important. This is not trying to be melodramatic, but for some people, this is the difference between life and death. If they had the coverage they need to take care of the injury or disease or the illness that they're experiencing, it's the single most important thing in their life at that moment.
All right, so I am a financial planner. I look at it as something that is necessary, and I look at all insurance as kind of a necessary evil. You always hate paying the premiums on insurance, and you hope you never ever have to file a claim. But when you do have to file that claim, you want to make sure that it's the right claim. And as it pertains to health insurance, there are a lot of misconceptions about how Medicare works, how Medicare supplements work, what should you do through your retirement years, and how do you analyze it all. And those are the things that we really want to lay out here on the Guided Retirement Show. And you've seen the studies, Tom, where it says that somebody that's retiring, they're going to need, in most cases, they will spend somewhere around $250,000 on health care through their retirement.
Well, Dean, you're absolutely right. And one of the number one reasons that people in our age group go bankrupt is because of healthcare costs. And in most cases, there's choices that they can make that will offset the potential loss of assets, and more importantly, or maybe equally important, provide them the health coverage when they need it. And insurance, you're right, it's a necessary evil, and it's one that we don't enjoy. But unlike an auto carrier insurance or a homeowner's insurance, you may go years, and hopefully you will go years, without ever filing a claim. Health insurance, unfortunately, even if you're healthy, you want to maintain that health. There's wellness exams, there's pap smears, mammograms, all the things that help keep us healthy have an expense. So translating that, the human body just has parts that wear out And you don't have to have a windstorm or a crash at the intersection to have a need for health care. It's an insurance that's used.
All right, so I want to make sure that as we're talking about healthcare in the context here on the Guided Retirement Show, that we're talking about it specifically in the context of someone who has retired and who has reached Medicare age. Tom, I've met with dozens and dozens of people over the last few years, especially since the Affordable Care Act came out, that have delayed their retirement until they are Medicare eligible because of the high cost of individual coverage prior to Medicare. And I think that there's a lot of confusion around how Medicare actually works. So the first thing I want to do is I want to break down Medicare so that it's simple to understand. There's multiple parts of Medicare, so I'm going to let you start. You're the expert here.
Okay.
All right. What's the basic Medicare? What's the first part that we need to know about?
Medicare A, there's always a confusion, or there's oftentimes a confusion between what's Medicare A and Medicare B. I hear both terms, and I'm not confident what one means over the other. So the best way to remember it is if you were going to be in the hospital for 2 weeks, and you ask me, Tom, would you please pay for my hospital bill or my physician charges? Well, you would ask for the hospital bill. That's going to be the largest expense that you're going to incur in that 2-week hospitalization. That's what Medicare A covers. It covers the inpatient hospitalization, and that can be very, very large.
So is that it? That's all Medicare A pays for is hospitalization?
Pays for hospitalization. It pays for skilled nursing, and hospice.
Okay.
That's the three coverages that you get through Medicare Part A.
All right. You said something that might confuse people. You said it pays for skilled nursing. And I know that there are a lot of people, even though you and I know this isn't the case, that think that Medicare is going to take care of skilled nursing.
And let's divide this. There's two separate paths here. Skilled nursing, the definition of skilled nursing from Medicare is, will this person improve? Will skilled nursing care make this person's condition, whatever that condition may be, will it give them an improvement? Will there be a better outcome? Contrast that to nursing home care, where there is no possibility or very little expectation of any improvement on the care. The person is simply living in a nursing home because they're too ill or too injured to be home by themselves. Maybe there's no one to assist them, but they're not going to get better. They're just living their life out.
Who gets to decide that?
Well, the physician and Medicare, in this case, would make that decision. But it's going to be primarily the physician. They're going to be able to look at what's happening, and they're going to know.
So let's say for an example that the doc says, there's no chance of you coming out. What's Medicare going to do then?
They're going to tell you that you need to go into a nursing home, and there is no coverage for that. From Medicare, there's no coverage for a nursing home, standard nursing home. There's long-term care policies that are available. There are some life insurance policies that have provisions for this, but Medicare is not going to be the source of income to offset that expense.
So the risk there is that nursing home expense could wipe out lifetime of savings and leave a surviving spouse destitute.
Absolutely. Depending on the state you live in, some states will only remove 50% of the assets if it's a husband and wife, or if it's in that situation. But many states, they're gonna once the assets are completely gone, then the person would probably be eligible for Medicare. They would move from a Medicare to a Medicaid type setting. But your point's accurate. Their assets are gone. They are financially destitute.
All right, so let's go back to Part A.
Okay.
Part A is taking care of hospitalization. Part A is also taking care of long-term care, but not nursing home.
That's correct.
Okay, so I'm confused at the difference, and I know that people listening to the podcast here have to be confused. What's the difference between long-term care and nursing home in the Medicare definition?
For Medicare to cover it, there has to be the probability of an improvement in the condition. If the condition you're experiencing is not going to improve, then Medicare is they're not going to respond to the expense of it. You need to go into a traditional nursing home setting for which Medicare pays zero.
All right, so let's make sure that I'm clear on Medicare Part A, hospitalization and long-term care. Anything else that Part A pays for?
Hospice.
Hospice. Okay, well, hospice is just the final days, right?
It is the final days.
Okay.
And it is pretty strange how accurate physicians have become in today's world of medicine. They can very well predict when you're within that last 6 months of time period. I mean, sometimes they're surprised, but seldom. They've got that pretty well figured out. And it's a fabulous coverage. I mean, people don't think about or talk about hospice because you're right. It's the last days of life, but those last days of life can be very traumatic for your family, for your children. So hospice has a lot of aspects to it besides just the individual that's expiring.
All right, so let's go to Part B then. You said there's Part A and there's Part B. What's Part B?
Medicare Part B is the outpatient services. My example, if you were in the hospital and I asked if you wanted me to pay the hospital charges or the physician charges, Part A covers the hospitalization charges. Part B would cover the services not covered by Part A, the physician charges, the lab charges, the x-rays, the durable medical equipment, wellness exams. All aspects of wellness is covered under Part B. There is some very, very minor prescription drug coverage under Part B. But for most of us that think of prescription drugs and the drugs that we take on a daily or monthly basis, those are not covered under Part B. The Part B benefit for prescription drugs, which is extremely limited, are primarily the very expensive injectables that you will get either in a hospital setting or a physician setting. But for all of our day in, day out prescription drug usage, there's none. So Medicare does not cover prescription drugs with that minor exception. But Part B picks up what Part A doesn't. When you see a physician when you're in the hospital or when you're out of the hospital, and it also includes all the preventative services. So, and most of the preventative services under Part B are covered at 100%. They encourage you to have the annual exams, to have the flu shots, to have the PAPs and MAMs and prostate exams. They want to help you. They want to encourage you to stay as healthy as long as you can. And sure, that's going to save Medicare money, but you're going to personally go through less pain and suffering, as well as Medicare saving money. So it's a win-win situation.
All right, so what do I do? I've got Part A that's covering my hospitalization, my hospice, and 90 days of long-term care with that 30-day one-time additional.
Right.
And then I've got my Part B that's going to pay for the physician's charges and all the other ancillary things that are there for that hospital stay. But there's only a minor portion of Part B that's going to cover any kind of prescription drug. What do I do about prescription drugs?
Prescription drugs, we have prescription drug coverage under Medicare Part D. D is in David.
Okay.
So
I've got A, B, and D now.
You've got A and B and D, and we're not done yet.
Okay, so this is part of the alphabet soup. Okay, so now we're on A. We did A. We did B. Anything else on B that I missed?
Well, a couple things that's probably worth mentioning on A and B both. To qualify for Medicare Part A, you must be a U.S. citizen, or you must have lived in the United States legally for 5 years, and the premium for Medicare Part A, there's many people that say Medicare Part A is free. And Dean, it is certainly not free.
But how do I pay for it then?
Well, you and your employer through FICA contributions. When you looked at your paycheck, if you ever looked at the deductions, you'll see an FICA deduction.
I work for free. I don't ever get paid. Yeah.
Okay. I don't know how to respond to that one. FICA is a tax that you and your employer have paid into the federal government. And if you've had 40 quarters or more, 10 years of FICA contribution, and most of us have had many quarters more than that, you have simply prepaid your Medicare Part A premium. So it's not free, but there's no out-of-pocket expense. There's no premium.
You paid for it before you got it.
You paid for it before you got it. That's exactly right. And it's the benefit far exceeds what you have paid as far as contribution into FICA. If you went to a commercial insurance entity and said, can you replicate what Medicare Part A does, what would the premium be? And Dean, I'm going to guess it would be $800, $1,200 a month. And you have,
if you waited until the time.
well, and that's based on the assumption that that an insurance entity could and would write a policy that matched or mirrored Medicare Part A. The point being is that it's a sensational value. It's a true gift to our age group.
All right, now you say it's a sensational value. And I don't want to politicize this discussion, but does that get into one of the reasons why the politicians are saying that Medicare is broke?
It's awfully hard for me to guess what goes through a politician's mind.
Well, okay, that's fair. That's fair.
But it's this is Tom Allen's personal opinion based on years of experience and a lot of reading. I think that the people inside the Beltway use Medicare's bankrupt, Social Security's bankrupt, as a scare tactic. These funds that pay for Medicare and also pay for Social Security do not come from the general pool of annual budget.
Right, but on Medicare, aren't we deficit spending right now?
We're not deficit spending right now, but we're now to the point where we're paying our own way. And could Medicare go away in the future? Sure, it could. There's an awful lot of talk right now for a single payer health system. And will that occur? It is my opinion that it will occur. Will it occur during my lifetime? And I'm sadly a few years older than you are, Dean, but maybe it may occur during our lifetime. And it's and not to be political, it's not a Democrat statement, it's not a Republican statement, it's a mathematics statement. When you look at what we're spending on as part of our gross national product on health care, as that number continues to grow, and it has continued to grow since I became involved in this industry, and there's nothing in place that's going to slow down significantly the increases that we're seeing from what hospitals and pharmaceutical companies and hospitals charge. We're going to come to a point where the percentage of our gross national product that goes for healthcare is so large that we're going to have to start choosing between sleeping indoors, eating 3 times a day, or having health insurance. When that day comes, we're going to have to do something. And nationalized healthcare, single payer healthcare, certainly looks like the most logical step.
So how is that going to be any different? Does that mean it's going to be cheaper? Does it mean that the coverage not going to be as good? Is it going to control the prices? I mean, how does that work? And if healthcare is going up, and by the way, when I put together a financial plan for somebody with our guided retirement system, I'm projecting healthcare costs are going to increase by 6.5% per year throughout their entire retirement. And it's kind of scary when I put that on a graph and it's showing, here's what your healthcare expenses are in your early years as a percentage of your total spending. And as time goes, how the healthcare portion of your spending in retirement actually increases at a much faster rate than everything else does. And so, you're 20 years into retirement and you've got far more as a percentage of what you spend in retirement being laid out for healthcare than you do for your normal living expenses. And if you don't plan for that, if you haven't projected that in, then what happens is that what you're saying is right, that you are now choosing between healthcare and having a place to live and 3 meals a day.
Exactly right.
But a lot of that has to come back onto a person's own ability to plan and project, right?
Dean, it does.
And not being reliant, because I think you say that single payer system, and I think many people think, well, then that means it's free, it's covered. This is now, Sweden, and we've got a healthcare system that we don't have to pay for.
Well, nothing is free, and your point's accurate. And you use Sweden as an example. In the Scandinavian countries, they provide health care from cradle to grave. They provide education from kindergarten through college, and there's no cost for that. Oh, except that they're taxed at about 70%.
I was going to say they don't get to keep much of what they make.
No, and surprisingly enough, the government has no problem at all getting their tax dollars. Your employer sends your salary to the Swedish government. They take their 70 cents and they send you a check for 30, and they get first bite of the apple. They never have a problem with tax collection. And so to say that it's free is about as far from the truth as you can get. You're just being taxed at a very, very high level. And if you are not in school and if you're healthy, you're obviously paying a lot of money out of your income for people that are receiving those services. And your points, going back to your point about people spending 6.5% growth, which unfortunately, as you pointed out, compounds and really grows into a huge number quickly. A lot of people think this is not going to apply to me because I don't spend anywhere near those numbers on healthcare, nor does my spouse. And the reality is, if you bought a loaf of bread this week, you probably paid a penny and a half of the price of that loaf of bread for the health insurance for the baker and the driver that took it from the bakery to the grocery store and for the grocery store that sold it to you. All of those people have overhead, and part of their overhead is healthcare costs.
It's the FICA tax.
Well, in this case,
or it could be the healthcare
cost
that
for
the employer is providing.
Exactly right. So every time we spend any amount of money,
but I'm talking about real hard out of the pocket, and I think that people don't think they do, but Tom, I've seen it. I've taken people from the day they retired all the way until they're no longer on this earth, and I've seen what the healthcare costs can do.
It's dramatic.
It is.
It can devastate. It completely wipe out their assets in a very quick period of time.
All right, so let's get back onto the whole Medicare discussion. I kind of got us off on a little bit of a tangent there, but I think it's important to lay that out.
Well, let me add. I mentioned to you, Medicare Part A is prepaid premium. Medicare Part B, there is a premium.
And how do we determine what the Medicare Part B premium is?
It is predicated on your adjusted gross income 24 months prior than going on to Medicare.
Okay.
And if you're a married couple and you pay taxes on your adjusted gross income tax with $170,000 or less, you are going to pay the threshold premium for Medicare Part B, which is this year $135.50
per person.
Per person. And it's important to point out that you should assume and you should build into your financial planning that there's going to be an increase in Medicare Part B premium. If there is a cost of living adjustment in Social Security, then that's the trigger for our government to be able to increase the premium for Medicare Part B. Now it goes up very modestly. It went from $134 to $135.50 this time.
Okay, but that's $1,626 per year per person.
That's correct. And it's
now. Hang on a second. How do I pay that?
If you are drawing Social Security, they will take that out of your Social Security check.
And what if I'm not? What if I've delayed my Social Security?
Which is wise, as you know. Then they are going to you can do it on a coupon basis where the government will simply bill you on a quarterly basis.
Okay.
And
what happens if you pass 65 and you don't sign up for Medicare?
Two things. And a lot of us in our age group are working past 65. We have the health, we have the desire, and there's a motivation for us to continue to get the benefits and all the advantages of continuing to work. If you are eligible for Medicare Part B, and you choose not to accept it for whatever reason, and down the road you decide that you want to take Medicare Part B, there will be a penalty for not taking it when it was first offered to you, when you were first eligible. The concept of group insurance is that many shoulder the expenses of a few. And if you chose to take your healthy shoulders out of the equation, you've not been shouldering the expenses for the people that are using it.
What's the penalty? Let's just say that I go to 65 and I'm like, I don't need this right now, and I wait until 70 when I start claiming my Social Security. And now I got Medicare premium. How much different is my Medicare Part B premium going to be than if I had started taking it at 65?
There's a penalty of 10% for each year. I'm saying that poorly. There's a 10% penalty for twice the number of years that you were eligible for Medicare Part B and did not accept it. So
break that down for me, really simple.
Okay, this year it's $135.50. If you went 1 year without taking Medicare Part B when you could have and chose not to, for whatever reason,
okay,
you're going to pay 10% of that $135.50 twice for that 1 year. If you go 10 years, you're going to pay.
So I'm going to pay $27 more a month forever?
No, for twice the number of years that you didn't accept Medicare Part B that you should have or could have.
I gotcha.
And the motivation, of course, is
So it's not a lifetime penalty. It's a penalty only for a couple of years after, or 4 years after, or 6 years after, whatever your delayed period was.
That's correct.
And it's just 10% of whatever that initial amount was, or is it 10% of what the amount is when you
It's
get
10%
on?
of what the amount is that year. So
Okay.
if it increases in premium, your penalty is going to increase.
Okay.
And it's simply a matter of, if you own 5 rental homes in a row and 3 of them had smoke coming out from under the eaves and you wanted to insure those 3 because there's going to be a loss of some sort, but you didn't want to insure the other 2, that's not how insurance works. Insurance is a small known loss of cost or loss of money to protect you for an unknown large potential cost to you if something should manifest itself or you should have some injury or illness or disease come up.
Okay, and then all right. So now premiums on Medicare Part B, $135.50, and well, as we're doing this podcast, we're in 2019. So if you're listening at a time that's later down the road, chances are the Medicare premiums have increased from what we were talking about here. Now you have the IRMA rules, right? So it's your earnings test to determine what your adjusted gross income is that can make those Medicare Part B premiums higher.
That's correct. And they can go up to $325 a month.
Do you get better coverage?
You get exactly the same coverage.
Well, that's not very fair.
Well, you can make that argument. The government feels that if you are in a financial position where you can make an additional premium, then they're going to have you do that. And their goal, certainly.
So this is a form of means testing.
It is at the government level. That's exactly correct. We have a Barber Financial client that is in the highest tier of premium for Medicare Part B. And she pointed out that seems terribly unfair. And I offered to change income and pay her premium, and she could take my income and pay my premium. And that was not a choice that she wanted to make. She wants to continue to enjoy the income that she's experiencing. And no, it's not fair. But everything in life is not fair, and that's one of them. We have to smile.
Well,
and
I kind of chuckle when I say that because there's a lot of people that say, well, at some point they're going to means test Social Security. At some point they're going to means test Medicare. Well, they already are.
They already are.
They already are. They just don't call it that, right? You got that
exactly
increased
correct.
premium due to IRMA. You've got the taxability of Social Security at certain income thresholds that can make up to 85% of your Social Security taxable. For others, it may not be taxable at all.
That's correct.
That's a way of means testing. Both of those things are ways of means testing both Social Security and Medicare.
And that's a reality we're facing today.
Right.
That's not something that we have to worry about in the future.
But I don't think the majority actually understand that both of those systems are indeed means tested today.
They are now. Yes.
Yeah. All right. So now we've covered Medicare Part A. We've covered Medicare Part B. You said, okay, now we've got Part D, which is the prescription drug coverage, but we're not done yet. Let's go to D. Let's understand what D is.
Okay. George W. Bush, President number 43, signed the Medicare Part D coverage. And it is vastly needed and widely accepted, widely appreciated. Medicare Part D is a separate coverage for prescription drugs.
Is there an additional premium for it?
There is a premium, and you will purchase this through an insurance entity. This doesn't come to you through the United States government. This will come to you through one of the various insurance companies that are selling products, Medicare Part D products. Recognize that it is significantly controlled by Medicare. If you were going to start a Medicare Part D prescription drug plan and you wanted to sell it in 2020, sometime in May of 2019, you would submit to Medicare, CMS, your coverages and the premiums that you were going to charge for that, and Medicare would go through that program that you presented, and either they would approve it or they would negotiate because they have a minimum standard of coverage.
Okay.
Of prescriptions, and Dean, the Medicare Part D plan it's something I feel that a lot of people. Well, let me back up. People in my age group are afraid they're going to make the wrong choice. They're afraid that they didn't understand all the choices that were available to them.
Well, for good reason.
Absolutely.
It's complicated.
Well, and maybe their biggest fear is not that I made a wrong choice, but there was something out there that I never knew about that would have been a better choice for me. And this really flows into Medicare Part D. Medicare Part D carriers, coverage providers.
By the way, how many are there? How many Part D carriers are out there today?
Oh gosh, in our marketplace, there's half a dozen very, very good, strong Medicare Part D carriers. I only deal with, and I only certify with carriers that have the financial strength that ensures to me that they're going to be in existence 2 years from now, 5 years from now, 10 years from now, when we might actually need that coverage. Going with a company that has the lowest premium and the weakest financials does not offer me any peace of mind at night. Those 3 a.m. conversations where there's only me and no liars, it worries me a great deal. I want to know that carrier is going to be there when I need them. So the point I want to make.
So hang on, I got to make sure I understand this. Okay,
please.
So Medicare Part D isn't really Medicare.
It is
really a Medicare supplement that you can purchase separate, and you purchase that through an insurance company.
That's correct.
It's not something that's just provided as part of Medicare.
It's not provided as part of Medicare, but it is extremely controlled by Medicare.
Is it required?
No, it's not required. You may choose to take Medicare Part A, Part B, and choose not to take Medicare Part D. But where you're going is, yes, there's a penalty.
So you have a penalty if you don't have Part D?
You have a penalty if you don't choose to take Part B when you're first eligible. And the penalty, unlike Medicare Part B, the penalty is predicated on the national, and I'm at a loss of phrase. There's Medicare has a national minimum standard of coverage, and the penalty is somewhere this year, I think, $35.10. And your penalty, if you don't take Medicare Part D when it's first available, is that it's a 1% penalty for each year, but under Part D it goes forever. You will pay that additional premium. So it could be a matter of 36 cents. It could be a matter of $3.60.
And is that from the time that you choose to get on Part D, or is that just that's just your penalty for not taking it?
That's your penalty for not taking it when you're
What
first
if I've got a plan that I've retired from from a business that they are going to pay my health care coverage, which includes a prescription drug coverage? What if I have that and I don't need this Part D supplemental piece?
I would encourage a person to take a long, hard, healthy look at the retirement plan and the benefits that they offer to you. I spent an afternoon with a lady that was looking at removing her and her husband from a retirement plan that included
A retirement health insurance plan.
Retirement health plan, and they are paying zero premium, and their benefits far exceeds anything that they're going to get if they would choose to leave that retirement plan. But they also had a lot of additional benefits. They had some life insurance. They had some long-term care coverage. They had some coverages that if they walked away from it, and when you leave that plan, when you leave your retiree health plan,
You can't get it back.
it's a one-way street.
Yeah.
They don't let you back in. And
So again, let me just ask the question, and it's just a really simple, direct question. If I have that plan that's offered from my former employer that I'm carrying through retirement, and I choose not to take Part D because I don't need it, am I still going to pay that penalty anyway, even though I've got another supplemental plan?
No, there's in that scenario, you have prescription drug coverage.
Okay, so Medicare doesn't care whether it's one of these Part D supplemental plans, as long as I have prescription drug coverage through an outside insurer. Is that what you're saying?
Dean, I am, but really what I'm saying, yes. But what I'm saying is Medicare doesn't care if you have prescription drug coverage, period.
Well, they do because otherwise they wouldn't penalize you.
Well, if you have it through another vendor, or if you're one of the lucky people that don't take prescriptions and never take prescriptions, Medicare is not going to send you a letter saying we're unhappy with you.
No, but they're going to penalize you for not taking it.
But when
I just wanted to make sure that they
Sure.
weren't going to penalize somebody that actually had a policy that they were able to carry from their former employer through retirement.
Exactly correct. And there's a piece of this that needs to be mentioned, should be mentioned, that we've not talked about. Let's go back to the person that's 65 and intends to continue working, and there's he has to contribute towards he and his family's health care costs. The employer doesn't pay 100% of the cost. There's some kind of a co-payment from the employee. Does that employee have to take Medicare Part B to keep the penalty from occurring, although he's still continuing or she's still continuing to work and has coverage through their employer?
Okay, that's a great scenario. I can't wait to hear the answer.
And the answer is no. The government has no interest, Medicare has no interest in you paying, if you contributing on a monthly basis to your employer health plan. They're not expecting you to take Medicare Part B.
So if you don't take it, you're not going to have a penalty?
That's correct.
How do they know?
There's a certificate of credible coverage that an employer is required to give you when you terminate your coverage, when you terminate your employment.
Okay.
And that certificate of credible coverage is going to tell you the starting date of your health insurance and the ending date of your insurance.
So you turn that in when you go to Medicare and you apply for Medicare, so they know that you had coverage, so we're not going to penalize you.
That's right. It's the offset of the penalty. But Dean, there's a real important piece that's a lot of people seem to not be aware of. The ending date of that coverage, you have 63 days, not 65, not 60, not 70. I don't know why 63. You have 63 days to secure and put in place additional coverage without any type of a penalty.
I'm Dean Barber, founder and CEO of Barber Financial Group. I appreciate you joining us for this episode of the Guided Retirement Show. You can find links to this episode's show notes and giveaways all in the show description. You can also visit us at guidedratirementshow.com/6. guidedratirementshow.com/6. Don't forget, hit subscribe to this podcast. Share it with your friends. Everybody needs a guide in the complexities that surround your retirement, and that's why we're here on the Guided Retirement Show.
Investment advisory services offered through Barber Financial Group, an SEC-registered investment advisor.